7 days of severe pain gone in just a few minutes. Today we are draining a massive inguinal abscess. So keep watching to see the satisfying relief and a step-by-step medical breakdown. Let's begin.
Welcome back to Healfit Media. Today we have a very special case in the clinic featuring a brave young boy who has been in a lot of discomfort for the past 7 days. Actually, he developed a severe, painful swelling on his groin area. The pain was so intense that he could not attend school, play with his friends, or even ride his favorite bicycle. Seeing his suffering, his worried grandmother brought him into my chamber today for a consultation. Before making any cuts, the most crucial step in any surgical procedure is sterilization. As you can see, I am meticulously cleaning the swollen area and the surrounding skin using povidone iodine. By applying this antiseptic, we create a completely sterile field. Taking this extra few minutes to clean the area properly is the foundation of safe and effective medical care. During my initial examination, I noticed the area was significantly swollen, extremely red, and felt quite warm to the touch. By gently feeling the lump, I could sense the fluid building up inside, which we call fluctuation. I diagnosed it as a localized skin abscess. Understandably, the family was very anxious seeing the condition. I took a few moments to gently reassure both the boy and his grandmother, explaining that this is a minor and very common procedure and there is absolutely nothing to worry about. Now, I am making a small, precise incision right at the center of the swelling. This opens up the pocket, allowing the trapped pus to finally drain out and relieve the immense pressure the boy was feeling. While we watch this step-by-step drainage process, let's dive into some medical education. What exactly is an abscess? Simply put, it is a localized collection of pus beneath the skin. It usually starts when everyday bacteria enter the body through a tiny skin break, an infected hair follicle, or irritated skin caused by a sweat or constant friction. Once bacteria enter, our body's immune system immediately responds. It sends an army of white blood cells to fight the invaders. The resulting mixture of dead white blood cells, bacteria, and tissue debris is what forms this thick fluid called pus. How can you tell if you are developing an abscess? Watch out for a growing lump under the skin, intense redness, severe pain, and the area feeling unusually hot. Sometimes, if the infection is severe, you might even get a fever. Now here is a vital piece of advice for everyone watching. If you notice these symptoms, never try to squeeze, pop, or drain it at home. Actually, squeezing creates immense pressure that can actually force the infected pus deeper into your healthy tissues or directly into your bloodstream. This can cause severe complications like cellulitis or even a life-threatening blood infection. So always seek help from a medical professional. To prevent an abscess, focus on good personal hygiene. Take regular showers, especially after sweating heavily. Wear loose and breathable cotton clothes to minimize skin friction. And immediately wash any minor cuts or insect bites with soap and water. Now that the majority of the pus has been drained, the job is not quite finished. I am using a syringe to thoroughly irrigate and wash the inside of the empty pocket with normal saline. This helps flush out any remaining bacteria and dead tissue hidden in the corners of the wound. Following the wash, I am carefully packing the empty cavity with a piece of sterile gauze soaked in betadine. Why do we pack the wound instead of just letting it close? Do you know that? If we allow the surface skin to heal and close immediately, the empty surface underneath wound quickly fill up with pus all over again. By packing it with this medicated gauze, we keep the wound slightly open. This allows it to continue draining safely while the body naturally heals the pocket from the very bottom to the top over the next several days. Fast forward 7 days, and here is the absolute best part of my profession. Look at our brave young man now. The wound was healed beautifully from the inside out. The pain is completely gone, and he has returned to his energetic, happy self. Seeing him confidently riding his bicycle right up to my clinic and eating his ice cream with a big, bright smile is incredibly rewarding. This is exactly why we do what we do. Thank you so much for watching and learning with us today. If you found this medical case educational and helpful, please subscribe to Healfit Media for more step-by-step procedure and health tips. Take care, stay healthy, and I'll see you in the next video.